Hello, I am Dr. Farshad Amini Behbahani and this is short course of Iranian traditional medicine. In this section we discuss about signs and symptoms of dominancy of the phlegm. Phlegm is reservoir of the body. It circulates beside sanguine humor through vessels, and when sanguine humor is over and consumed by the organs, it replaces sanguine humor by another digestion, by an additional digestion, and turn its temperament, its cold and wet temperament, toward warm and wet temperament, that is temperament of the sanguine humor, and can consumed by the organ instead of sanguine humor. It helps people to tolerate hungriness until reach to a food. So those intrinsic temperament that produce less phlegm compared to other intrinsic temperament, for example in warm and wet intrinsic temperament, or in warm and wet temperamental age, for example in childhood, they can barely tolerate hungriness or fasting because the reservoir is low. Contrary, there are some intrinsic temperament or temperamental age, for example old age, or cold intrinsic temperament, cold wet, cold dry, or simple cold, that produce more phlegm compared to other temperaments. These temperaments are susceptible to production of noticeable amount of the phlegm, and if there is an improper habit, for example eating too much food, I mean more than the capacity of digestion, or eating food rapidly after undigested previous food, we have raw chylus that ends to more production of the phlegm in the liver. In these situations and in these temperaments, we have large amount of the phlegm that can cause some signs and symptoms very similar to cold and wet distemperament. Phlegm is told that is a white humor with a little sweet in the taste. So in dominancy of phlegm, the color of the face, the color of skin of the patient is white. Because it is a wet humor, the skin is soft and flexible. Also, we have this flexibility in the joint, and we have reports of recurrent dislocation. We have looseness of the tissue of the body, so we have hanging cheek. We have more sleep compared to other dominancy of the humor, which is very similar to wet and cold distemperament. We have two sticky saliva, sometimes white coating on the tongue. We have more production of saliva, a mouth full of saliva, sometimes drooling of saliva, and no feeling of thirstiness, unless because of some medication or some spices or some psychic feeling that cause, for example, sadness and more warmness in the digestion system. This normal phlegm turn to salty phlegm, in this situation we have thirstiness, especially at the night in the middle of sleep. This thirstiness will increase by drinking cold water and will be cured by drinking hot water or hot tea. Overall, the dominancy of phlegm, I mean normal phlegm, feel no thirsty. The urine of the patient is white. It is different from clear or diluted urine. We have also more production of urine that cause somehow dilution of the urine, but we have white precipitant mixed with urine. If you have a glass jar of the urine of patient, you can see a cloudy precipitant among the urine after 1 hour. And we have laziness, and in examination we have a slow pulse. A slow pulse means that pulse in its components take time to reach to top of its movement, and sometimes take too much time to go down, and overall expansion and contraction is done very slowly. This is a slow pulse in Iranian traditional medicine, which is different from bradycardia. Bradycardia means that the space between two pulses is large, is too much. Somehow, if coldness become more and more, and the amount of phlegm become more, we have bradycardia too. And dreaming of the patient with dominancy of the phlegm has some characteristics. The patient see all of the furniture in his or her dream white. Seeing snow, river, rain, or water, clear water, and feeling coldness in the dream are signs of dominancy of the phlegm. You can also have a history of the cause of more production of the phlegm. For example, intrinsic temperaments, or age, or living in cold area, and cold job, having cold jobs. Some jobs that are done in cold environment, or some jobs in the water, or some jobs that movement in job is very low.